Well, good afternoon. Yesterday, our top doctors and health experts provided us with an updated modeling. And what we saw was alarming. And Dr. Brown could not have been more clear. If we don't take action, if we don't change course in a big way, Ontario is on track for 6,500 new cases per day. That's 6,500 more people who will catch this awful virus each and every day. And based on current projections, intensive care units could be overwhelmed in 6 weeks. The impact on our hospitals would be absolutely devastating. As Premier, I can't accept that, and I won't accept that. My friends, we can't let that happen. We must do whatever it takes to slow the spread of this virus. We must do whatever it takes to stop our hospitals from being overrun. So we're here today to take action. We're here today to protect the health of Ontarians. My friends, 6 days ago, we began implementing a framework to provide an early warning system across the province. Our framework provides clarity and certainty to Ontarians and to local public health units. It focuses on early intervention in areas where we're starting to see cases rise. And it provides a baseline for additional targeted action in the areas hardest hit. This kind of coordinated, predictable approach to implementing public health measures, it's necessary, it's critical. But as I've always said, we need to be flexible. We must always be prepared to change course as the situation evolves. And the updated modeling yesterday made it clear that the situation has changed dramatically since we started implementing our framework 6 days ago. So today, on the recommendations of our Chief Medical Officer of Health, Dr. Williams, and on the advice of our Public Health Measures Table, we're updating our COVID-19 framework with new thresholds. We see the numbers rapidly increasing. Dr. Williams has also updated his advice to everyone who lives in the red control zones. Limit your trips outside of the home except essential reasons, like going to work, school, getting groceries, keeping a medical appointment, or exercising. Work remotely where possible. Families should not, I repeat, not visit any other households or allow visitors to their homes. And please avoid social gatherings. These adjustments, they're necessary to respond to the latest evidence, and we may need to make further adjustments in the future. I've asked Dr. Williams to take another hard look at the restrictions and come back to us next week with his advice if further steps are necessary. My friends, I know this will be difficult. You've already sacrificed so much, but we need to be clear about what's at stake. We're staring down the barrel of another lockdown, and I will not hesitate for a second if we have to go further, because our number one priority right now, it's getting these numbers down. But here's the good news. We can change the course. We can bend the curve and get this virus under control. Each of us have a role to play. Every one of us has a role to play in preventing a lockdown. We need to continue following public health advice. We can't become complacent. We need to fight and continue fighting. Please don't lose hope. My friends, never in our lifetimes, in a generation, has so much depended on our collective action. Never has so much depended on us coming together as a people, as a province. Together, we can and we will get through this. To all those celebrating Diwali this year, I know it won't be like last, but that doesn't mean it can't still be special. As you celebrate with your household, connect with family and friends virtually, and please be safe. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Since the start of this outbreak, our government has made the health and safety of Ontarians our #1 priority. As we've seen in Ontario, across Canada, and around the world, we continue to be at a very crucial time in this pandemic. Cases continue to rise around the world and here at home. We've seen cases increase 45% week over week. Positivity rates are increasing dramatically across the province. We have now hit 4.4% compared to 3.2% last week, with concerning increases in hotspots. Outbreaks are also increasing in more regions across more types of organizations. Over the past 7 days alone, our province has seen 71 deaths in long-term care homes. And as the Premier noted, yesterday we heard about the most recent projections presented by Dr. Staney Brown, which showed a concerning situation in our province. As COVID-19 epidemic continues to evolve, our government's response must evolve with it. And today it's clear we need to take action to stop the further spread of COVID-19, to keep our schools open, to maintain health system capacity, and to protect our most vulnerable. That's why, in consultation with the Chief Medical Officer of Health and the Public Health Measures Table, our government is taking immediate action to reduce the risk and protect the health and well-being of Ontarians. By making adjustments to our Keeping Ontario Safe and Open framework, we are doing what is necessary to continue to fight COVID-19. We're lowering the thresholds at each level to adjust to the faster rates of growth. Based on these new thresholds and in consultation with local medical officers of health, the following public health unit regions will be moved to the following levels in the framework. The following public health units are moving to red or control: City of Hamilton Public Health Services, Halton Region Public Health, Peel Public Health, Toronto Public Health, and York Region Public Health. The following public health units are moving to orange, restrict: Brant County Health Unit, Durham Region Health Department, Eastern Ontario Health Unit, Niagara Region Public Health, Ottawa Public Health, Region of Waterloo Public Health and Emergency Services, and Wellington-Dufferin-Guelph Public Health. The following public health units are moving to yellow, protect: Halton and Norfolk Health Unit, Huron-Perth Public Health, Middlesex London Health Unit, Public Health Sudbury and Districts, Simcoe Muskoka District Health Unit, Southwestern Public Health, and Windsor-Essex County Health Unit. These changes will come into effect on Monday, November 16th at 12:01 a.m., with the exception of Toronto Public Health, which moves to red control Saturday, November 14th. And while our response to COVID-19 will continue to evolve, it is extremely important that everyone continues to follow the public health measures we know work and keep us safe. Maintain physical distancing, wash your hands thoroughly and regularly, wear a face covering when physical distancing is a challenge or is required, and stay home when you aren't feeling well, even with mild symptoms. And if you live in a red control region, please only leave the house for essential purposes. We all have personal responsibility here to control the spread of COVID-19. Please, please do your part. That is how we can protect each other, reduce the spread of this virus, and keep our communities safe. Thank you, and now I'll pass it over to Dr. Williams.
Good afternoon. The modeling released yesterday by the Science Advisory and Modeling Consensus Table is alarming. Worldwide, we are seeing COVID-19 cases continue to rise, and Ontario is no exception. In recent weeks, COVID-19 cases, hospitalizations, and deaths have continued to rise. We are at a very critical time in our province. We know how difficult these past few months have been for everyone. But we need to get these numbers down to protect the health and safety of Ontarians and to protect our healthcare system from being overwhelmed. This challenge before us will be difficult, but it is not impossible to overcome. As I previously said, we flattened the curve before, and we can do it again. And it will take all of us to do our part. Throughout this pandemic, Ontarians have continued to demonstrate their willingness to follow public health measures, to keep their loved ones and communities safe. But I know you're getting tired, and I know that you want to see your friends and family and gather together like you used to. After months of dealing with COVID-19, this is completely understandable. But these gatherings have meant that people are having too much contact with each other. And this contact has resulted in COVID-19 cases. Several of our public health units are managing cases of COVID-19 related to large Halloween parties, and others are following up on cases because of wedding celebrations where proper masking and physical distancing practices were not followed. These interactions have had an impact on the health and safety level of our loved ones, on the community, and on the most vulnerable. It takes all of us together to stop the spread of COVID-19. Everyone has a role to play. We continue to ask all Ontarians to please continue adhering to the basic public health measures that we know to be effective and in order to protect your health and stop the spread of COVID-19, especially when connecting with others. So all things back to the Premier.
Okay, we'll go to the phone line for questions. Please, first question, please. First question.
Your first question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob.
Premier, I'm wondering why you waited so long, despite the warnings you were getting from a lot of public health people, epidemiologists, doctors, outside the government on these thresholds in the framework. I know you said that the modeling yesterday was a tripping point, but we seem to be back in a situation like the one we were in October before Thanksgiving, where you said everything was fine, and then all of a sudden you had to do an about-face on Friday, October 9th, just before Thanksgiving weekend began. So why do you seem so resistant to things that people who know out there in the community, including Public Health Ontario, are saying?
Well, first of all, I appreciate the question, Rob, and let me be very clear again. The modeling that I saw now is not the modeling that I saw a week ago or 9 days ago. And 9 days, 10 days ago, what I saw was anywhere from 950 to 1,200 cases. What I saw a couple days ago, it's 6,500. And I can reassure you that if I saw 6,500 cases 10 days ago, I wouldn't be out here today saying what we're saying. But Rob, we're going to be decisive. I've been decisive from the day that COVID has happened. I haven't missed a day. I've been transparent. I've been up here. I've been decisive when it took someone out there, the first in Canada, to close down our schools. As decisive when it came to testing and tracing. As decisive when we locked down the economy. And I'm going to continue being decisive all the way through this.
Follow-up?
I haven't seen the figures yet, but I'm wondering what the new thresholds are for the red zone or control. Public Health Ontario had recommended 25 cases per 100,000, and I'm wondering what they are now, and if they haven't met that level, why have they not met that level?
I'll pass that over to Dr. Williams.
So the public health measures table met, including with Public Health Ontario at the table, and we discussed the thresholds and how they should be impacted. So as you know, before, our red zone was higher at over 100. We've lowered that down to greater than or equal to 40 cases per 100,000, a test positivity rate of over 2.5%, and an R effective, or R I at that time, of 1.1 to 1.2 in there, and then lowered the other thresholds below that. So we had the discussion, and all around the table, including Public Health Ontario, unanimously agreed with that change.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We want to know what you would say to a business owner who lost their business during the lockdown in the spring and is now looking at these new projections, these new modeling figures of over 6,000 cases a day by mid-January, and is just wondering why they went through that in the spring when we only are to find ourselves here now.
You know, first of all, my heart breaks for all businesses that have been struggling. We put billions of dollars out there to support businesses and support the people. We're going to continue supporting businesses right across this province. Ourselves, our federal partners, will continue to support them on the needs that they require.
Follow-up.
Thank you. And my follow-up, we wanted to ask about the ICU 150-bed threshold and what's being done to increase that number, if anything at all, because in a province the size of Ontario, it's quite shocking to think that we can't handle a capacity more than that before elective surgeries begin to get canceled.
Yeah, I'll pass that over to the Minister of Health.
Well, thank you for the question. Currently, we have over 2,000 intensive care beds across the province of Ontario. They are 81% occupied right now, but we are building greater capacity with the announcements that we've made over the past few weeks, including the most recent announcement of $116 million to increase by another over 700 beds. So we know that we need to increase that capacity because we're also seeing that the age at which people are contracting COVID-19 is getting into an older age group with younger people. They maybe have been able to weather through the worst of COVID-19 without having to go into intensive care, but we know that that's not the case for older Ontarians. So we have to be prepared for that, to be prepared to deal with increases in the numbers, and we have built that capacity increase into our fall preparedness plan, and those our beds are coming on stream now.
Next question.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Premier, you often mention how your heart breaks for business people who are struggling to get by in the pandemic. You just said so a moment ago. I actually can't recall the last time you said about your heart breaking for the families of people who are dying in this pandemic. In the past week, there's been more than 100 people in Ontario with COVID who died. Why aren't you talking about them?
Mike, nothing weighs more on me than when I talk to family members on the phone. And they tell me, I met a lady the other day that came up to me and said, I want to thank you for doing a great job, and I lost both my parents in long-term care a week apart 2 weeks ago. Mike, I take hundreds of calls. One of the few elected officials in this country that has his phone number, that's up till midnight in his office, taking personal calls and listening to the concerns. Does that weigh on me, Mike? It weighs on me, I can assure you. I was up since 2:30 this morning. I was out driving at 6 o'clock this morning, getting on the phone with people, texting them, talking to the Mayor of Toronto, talking to the CEO of Sunnybrook, talking to doctors. Mike, for a second, if you don't think this weighs on me, you don't know me very well. It weighs on me, believe me.
Follow-up.
I wanted to ask you specifically about long-term care as well. Minister Elliott mentioned 71 people have died in long-term care this week. What happened to the iron ring that you promised to put around long-term care, given the number of deaths that have happened in the second wave?
Well, we're making sure that we're doing everything absolutely possible in our powers to continue enhancing the iron ring, as you may say, around long-term care, increasing funding, making sure we're taking care of the PSWs that are absolute heroes, that are in there every single day. I will spare not a single penny when it comes to protecting the people of this province, no matter if it's long-term care or anyone else. But we'll pass this over to the Minister of Health. Thank you.
Well, we have been making significant investments into the protection of people in long-term care, building that iron ring around them, making sure that there's the personal protective equipment for staff there, making sure that the residents are protected from outside transmission, testing the staff, testing the residents on a regular basis, and we're going to continue to do that. We're also going to move in some of the new rapid tests that we have recently received so that people can receive answers faster, whether it's family members or whether it's staff, to make sure that they can go in to see their family members, but make sure that they know that they are safe, that they don't have COVID-19. But part of the problem is that there is this community transmission that's happening, and that gets reflected in what moves into long-term care homes. That's one of the reasons why we're taking the steps that we are today to cause more regions to now, because of the new thresholds, move into some of the more restricted zones earlier so that we can protect our most vulnerable. That's a critical part of our plan.
Next question.
Your next question comes from Melissa Candelaria with Your TV Halton. Please go ahead.
Hi, Melissa.
Hi there. Hi. I was wondering if you can be a little more specific, and I'm not sure if this is a question for you or the minister, but as to why Halton was moved into the red zone.
I'll send that to Dr. Williams.
So with our new numbers, Halton, when we were discussing with them before, we're already moving into the orange zone, well in there. And we look at those different metrics and measure and discussion with their medical officer of health. With the new level that used to be in the orange zone dropped down for the red zone to greater than equal to 40 and the positivity rates, that means Halton numbers are clearly in that zone there. So that's why all the zones have changed in their thresholds to bring them down to initiate actions even sooner in that light. And so some of that were in other zones before are being notified, and we had a conversation with them already that they're now shifting to the new zones in the adjusted framework.
Follow-up?
I guess my follow-up would be, with this red zone, there's certainly going to be a lot of more restrictions, and I just wanted to see why you wouldn't just do a massive lockdown, considering the holidays are coming up, and put every region, including Halton, into the gray zone.
Well, thank you. And as I mentioned in the press conference yesterday, as we're looking at the issues, you're correct. As we have the red zone and on our framework, when you see the documents, there is to the right of that the gray lockdown zone. The question is, when would one do a lockdown? What would the lockdown consist of? Does it consist of closing certain aspects, all aspects? Does it include closing schools, yes or no? What do you do with long-term care visitation? We have these balances to make there because there's other consequences of the lockdown that you have to deal with. So we will want to make sure that advice comes from the public health measures table to mine, to the minister and premier, because I think as the premier would say, that would not be a light decision at all. It's one that has to be taken and weighed out, because while you lock down some aspects, you lock down other services and provisions at the same time, and you want to make sure there's the right balance. So therefore, we're taking our issues to the public health measures table, and then we'll bring back recommendations to the minister and to the premier next week.
This will be the final question.
Your final question comes from Matthew Bingley with Global News. Please go ahead.
Hi, Matthew.
Hi, Dr. Williams. I want to ask you about surveillance testing. An epidemiologist I was speaking with said that it would be probably best to change up everything right now by being more proactive in testing, by going out to the restaurant staff and teachers, so you wouldn't have to wait for them to show up in the form of outbreaks. And with the Premier talking about doing everything possible to prevent anything from happening, and with cases still on the rise, would it not make sense to change up the testing strategy?
So our testing strategy is always being looked at. I know the Premier's probably itching to come up and talk about rapid testing and with the desire to bring that even quicker. And we're looking at many modalities, and the Minister of Health knows about all those. So when you talk about surveillance versus screening versus case contact management and testing, there are different aspects that are there. And some of our people feel that we should make sure that our top testing is for those that either have signs and symptoms, have had contacts or cases, because a test on one day negative while you're incubating, you could be actually positive 2 days later. So you have to assure what you know you're looking for, and when you do a test, that someone doesn't take that as a false sense of security and casually goes out and exposes everybody. So just because you have the test done, you still have to maintain the public health measures until that time that you're really assured of your period of not being communicable, as in you've had no contact with anyone for that period of concern. So you raise a good point. We're looking at that all the time between screening versus testing versus surveillance, and all those are important issues, and they all demand a lot of staff time and work, including work on the staff and people, and to set those infrastructures up. And I know my counterpart, Mr. Anderson at Ontario Health, is working hard to put those things in place, as is Minister Elliott and the team, and the Premier, I know, is very adamant about doing this.
Just to follow up, and thank you, Dr. Williams. I want to mention there's absolutely zero, from day one, zero daylight between myself and Dr. Williams. I listen to Dr. Williams, I'll listen to Dr. Brown. I think an earlier question was, why didn't you listen to the 100 other doctors? This is who I listen to. I listen to Dr. Williams. Underneath Dr. Williams and Dr. Brown, there's probably hundreds of people giving Dr. Williams advice as well. But that's who I listen to. On rapid tests, and thank you, Matthew, for that question. It's an excellent question. So you've heard me coming up here about rapid tests. We have the rapid tests. They're all being rolled out. I'll give you an example, and I hope they don't mind me saying it, but we have reached out to the private sector, especially large companies. Magna has thousands of rapid tests heading over there. We're reaching out to other large employers, and we have a solid plan that they went through the other day with me, and we're getting it out the door. And we're going to continue getting it out the door on these rapid tests to large employers everywhere, including government employers, be it Metrolinx or other government agencies, to make sure they get tested. But thank you for that question, Matthew.
Follow up, Matthew?
Hi, yeah. You mentioned the fact that there's no daylight between you. It sounds like Dr. Williams is still lacking clarity on what is required to get to that gray zone, and I'm just wondering why this framework was released without having a clear answer on that. And also, just to tag on to that, the Registered Nurses Association of Ontario is asking the province to shut down everything but essential businesses for 28 days in the red zones to try and protect the long-term care homes. Is that something you would consider once you actually have an answer on that?
Well, Matthew, let me be very clear. Everything is on the table. I've been decisive from day one, and I'm going to continue being decisive. When I get the green light and Dr. Williams says the tables come back and they want a lockdown, I will lock down quicker than you can blink your eyes, because my number one priority is to protect lives, protect the safety of every single person in Ontario. And I won't hesitate for a heartbeat to do that.
Thank you, everyone.
Thank you so much.